my dean, the dean of the Faculty of Nursing, University of Medical Sciences, Ondo. And I want to say good morning also to the faculty members, distinguished guests, my dear students, and other invited guests. I want to appreciate the grace and the opportunity given unto me to come here all from Foye to deliver the lecture. And at the same time, I want to thank my mother, my mentor, a person of Professor Oluwatosin, from the university. She mentored us, and God has helped her to make us who we are today by His grace. Thank you, ma, for what you have imparted in us. I appreciate you, ma. Thanks so much. And I also appreciate all the LOC of the programs. Thank you and well done. Well, this morning, before me, I have a topic, Embracing AI in Nursing, under the general theme of the innovations in patient healthcare and exploring technologies and strategies for improving patients' outcome. I know quite right that most of us were for nurses. Thank God for the kind of trainings we have. I know we are able to move from, let me say, we can improvise. In those days, we move from the era of writing reports to era of electronic health records. I know we move from the use of a traditional stethoscope to the use of monitors. And now, this is era of technology. And we could see, and part of the new technology that improve patient outcome is what we want to delve into this morning. And that is what we have, the AI. You could see the nurse interacting with AI materials. Then let me ask us some questions before we proceed. Number one, I want to ask, have you ever used an AI tool? ChatGPT, Siri, Alexa, clinical decision supporting system in your daily or professional life? No, well, you've used ChatGPT. How do you feel? How do you feel about AI? Really excited? Curious? Excited because it makes the work faster? Good. It makes you to do assignment quickly? Good. Then skeptical. I know our teachers will so much skeptical. These people, students will use it. In fact, some of you will submit assignment without reference, nothing. We just copy from AI and you give it to us to be sorting it out. We begin to see that what will be the future of nursing? What will be the future of our education? If we are giving students, we submit assignment, even writing projects, you will see a touch of AI in all these things. Well, do we feel concerned? Those are the various feelings we could have. Then, in which area do you think the AI will make the biggest impact in nursing? In which area? Research? Really? What, because you use it to write your, your projects. What about the patient care? What about nursing education, administration, and this thing? Well, let me give us now a case scenario. You are in a ward and a BC intensive care unit, and you have an AI-powered system that will predict the condition of a patient, at least a patient deterioration 6 hours before the time. You hear the alert system is there, probably there's an alert, and that prompted you to go to the patient. And you discover the patient is still stable. Must you take any action? Must you take any action? And if you are to take any action, I'm asking myself, must you take any action? Why? Why? You know the patient is stable, you check the vital signs stable. Why? You know, in those days, I've seen, in practice, when I was in school, I've seen patients that we will only know that we met the corpse on bed when we're taking over. because there's no indication, nothing to alert us that the patient's condition was going somehow. But now you have an AI-powered machine that will tell you something 6 hours before the time. Then, what should you do? Yes. Yes, I'm asking my students. What? And why? The patient looks stable to you. Must you take any action? Yes, good. Thank you. Now this will take us through the outline of this presentation. We'll look through the introduction, the concept of artificial intelligence, the AI tools, some of the AI tools, let me just put it like that. Then the AI in nursing, in the 3 major areas, in nursing education, nursing practice, and nursing research. And we also looked at the ethical use of AI, then we bring it to conclusion. Then if you look at AI, this is like a picture of a human brain with the neurons, how active it is. That's how AI works. And in this era of integration of technology to healthcare, it now becomes like a force, a driving force to the transformation that we see in healthcare and also in nursing. And among these innovation is what we refer to as artificial intelligence. And it's like a branch of computer science that tends to stimulate like human intelligence. Human intelligence is form of learning. You learn, you reason, then problem solving. I made it as you perceive, you think, and you act. That is it. That is how AI works. You perceive, you think, then you act. Those are the major 3 of AI. So let's look as nursing is a dynamic profession, evidence-based profession that basically is centered on compassionate care. We also know that the use of AI, both in education, in research, and in practice, is expedient, so that we could move as the world is moving. And at the same time, we improve the patient outcome. And this is the major area where we need to know and to delve into. So it is on this note that we have to embrace AI in nursing. It's not that it's replacing human care. Initially, when AI came, he said, because you use robots, said, no, we don't want it to replace nursing. We are not accepting it. But no, AI has come to stay, and we must move with the trend. And so it is not about replacing human care. It's not about, it's just to reduce our workload, make a kind of help in augmenting our clinical judgment. And that's the example I gave the other time. That you are in a busy ICU ward, you have AI-empowered machine that will predict a patient condition. So if that one will tell us that at this also time you should act fast. That is the essence of AI. So, and that's the reason why we have to embrace artificial intelligence in nursing. Then, what's the concept of artificial intelligence? It was first coined out at a conference by John McCarthy and his other co-friends. And you see, but this gained popularity in very few years ago, 3, 4, 5 years ago. And I thought it is the ability of machines to mimic human cognitive function. And this human cognitive in just 3 areas, which I've said earlier, in learning, in reasoning, and problem solving, which I simplify as you perceive, you think, and you act. So it encompasses the field like machine learning, language natural processing, which is what we give to AI. When you add language, you throw a language, it responds. So also robotics, which is what we use, robots, which we still get there when we come to practice, and computer vision. So, and one thing that is so peculiar, so wonderful about this thing is that when these systems are powered, it enables us to analyze data. We can recognize pattern. What we input into AI is what AI will give us. Also, it also helps us to make decisions and also interact with other humans. And in healthcare, most times it helps us in nursing and generally in healthcare, it interprets medical complex data. You see, initially when we do go for x-rays, in those days, they will tell you, you come for, if you want radiologist report, you come for the result of the x-ray maybe after 72 hours, or initially they will even give you 1 week. But with AI, by the time you are even, it will interpret the result fast, and you are getting the result. So provide diagnostic suggestions, also predict patient deterioration, and also some of the routine tasks. You can use robot to serve drugs and to do some routine procedure in the ward. All these, and if this comes into, if we accommodate or if we embrace this in nursing, most of the burnout we are experiencing, we will not experience it. And it makes our work to be faster. And most times, when we are stressed, that's where you see various the different definitions of the nurse. The patient will give different names to the nurse. But when we have powered machine, AI-powered machine that help us to discharge some of these duties, we work under a very relaxed atmosphere and we are less stressed. So, and that's why we have to. So these advancements has made the various AI tools. I have some here. You can read more about some of the AI tools. We have AI-driven clinical decision support system, and that's what I have explained to Rod earlier. This one we enhance diagnosis accuracy and treatment. Give you treatment when you want to diagnose using MRI, imaging. Immediately we just do a diagnosis, because I'll be AI powered. It's able to have a kind of evidence-based, accurate diagnosis and also treatment plans. We also have a predictive analysis. That's the one in which has been powered to detect any deviation from normal in a patient condition. You see most times in our ICU, why it does that, we see ICU that are more expensive. If a patient sleeps in ICU, I had a patient about 13, almost going to 12, 13 years ago in ICU here. Then, as at then, it was 150 per night. A patient sleeps over. So you see what is so special in ICU. These are the things, most of these AI-powered machines that help patients. You could see, not you just as a nurse, you just carry your tray. It is 2 o'clock, go and do vital signs. By the time they monitor, it will just tell you all the patient's condition, the vital signs, the blood pressure. If it is having any deterioration from normal, you easily detect this. Also, we have machine models predicting, we have the language, natural language processing. And that's what we have in our, most of these ECG. It comes in a wave, something like a wave. It interprets. When you are AI-powered, the machine is AI-powered. It will interpret all these waves in English language or in a language, the natural language that somebody can understand. Also, we have robotics. These are assist in some of the tasks we may have, either within the ward, routine procedures, and so on. Why the call to embrace AI? Why? Why the call? Some of these, the Japa syndrome has made also have most times shortage of nurses. If you see in a ward, we see a surgical ward. We have in a ward we have 28 bedded ward with full of patients. Most times we can have 2 nurses on duty, even on morning duty. And these are people you expect to carry out almost all the procedures in the ward, and also to attend to other administrative issues. And you see, because of this, if you embrace AI, all these challenges that we are having, AI can help in most of these things. And help us to then, we have the burnout rate, which is also high, and that's why we have to embrace artificial intelligence. Also, most of this increasing patient complexity and that we have all around. Those are the current challenges that we have that has called for the need for us to embrace artificial intelligence. Also, the need for innovation, new things. Let's learn about it. Let's see something that is new. What can help us then, and for the quality and well-being of the nurse. And the role of the AI too, it helps boost efficiency, accuracy, and also we have patients experience it dramatically. You see, in a twinkling of an eye, you see just a change in a kind of what it is expected to be done. It's also help us to support data. Then we will look at this concept of AI in nursing in three major areas. In three major areas, we have the nursing education, I said earlier, study, research, and practice. Let's see what we have. I know as students, we know AI is transforming most science, nursing education. In my school, what we do, in fact, it is compulsory that you must do online teaching. If you don't do online, because the remuneration is attached to it. And what do? They ask us to, you will, like in a video, you teach, and you go and upload it on the e-learning portal. The student will be able, at their own pace, it's AI powered. You will be able to, the student will be able to go over as if you are in the normal class. Those are the things that also helps in education. Then we also have called something intelligent tutoring system, and that's why for some people that are gone for maybe NCLEX exams, especially when it comes to oral exam, English speaking exams, that you see, we have some of the intelligent tutoring systems that are being introduced by some manufacturers. Or you see, most times it will teach you on most of this. You will be with it, teach you, and take you to a kind of what you are supposed to do and what you are supposed to, the way to pronounce some things. Those are the things, or the way to the virtual nursing tutors. All these are what is so important. And when you intelligent tutors, it also help us our work to be lesser and also aid our cognitive function. Also, it assists with the educators. Especially, look at AI, for instance. Look at ChatGPT. By the time you are in class, in fact, there are times that even if you throw something to it, you throw questions to it and say you prepare the marking scheme. In a twinkling of an eye, they bring the marking scheme for you. So all these things are the things we have in AI. The ChatGPT, for instance, which is so common among the students and among us. You see, all these help to inform in one way or the other, as to make our work faster. Also, but at the same time, there are challenges about AI, especially about our academic integrity. You know, in those days when we are writing projects, you download the topics differently, and you begin to read from some of the, if you maybe you download about 10 articles, you read through before you can pick. This one will serve as the first part of the introduction. This one will follow. This one will follow. But there are times that even the way we use AI, we get to the ethical what's the use of AI, what we should put into consideration. So begin to query what is the academic integrity of AI. So we have, as teachers, as educators, we also need to work on this. So what are the AI that is normally common? You could see that this nurse interacting with this adaptive learning. This adaptive learning museum. You see, those are the name of the company that customizes it. So you see the nurse interacting with that AI is an adaptive learning on her own. He's not in class, he's maybe in her room teaching. Maybe the adaptive learning is learning what the AI has powered. It's just for her to stay and listen and learn those areas that he has to, based on the particular subject matter. Then we also have chatbots and visual assistants. And the chatbots is what will happen in ChatGPT. You input the language in a tickling of an eye, just give the instruction. It will also give you the feedback. For some people, there are some iPad-powered Siri. When you ask, you just have to, also by the virtual learning. It's also when you speak to it, you say, that so number, and immediately it will do. And we have some homes that are also powered with AI. Just speak, and on the light, it will do. So those are the extent to which AI has gone, and we have to key into it. We also have virtual simulators and AI-powered mannequins. We have some AI-powered mannequins or virtual simulations in which most times you have It will just be demonstrating the procedure. You will just watch. A few days ago, I was listening to my students on, we did OSCE, and I was really post-examination meeting, and I was asking, after the examiner, invited the examiners as passed their comments, and I expected the students to. I wanted to have a feedback from them, and I encouraged them to talk. And you know what they told me? Said, we were only taught the procedure once. And I told them, in our days, they taught us once too. But we did not have the opportunity you have. Now you can go to YouTube. You can you can see procedures. It will teach you step-by-step procedures, which we did not have the opportunity. So don't stop telling me it is once. They said, just taught us once. I said, that's no excuse. You have to practice over and over and over again, based on the opportunity your generation have. And in the last, I think in April, we went for a conference in Ibadan, where they added some things to the curriculum. And part of what was added to midwifery curriculum is this virtual stimulation of essential newborn care. And with some other things added. I know the MCH team and other teams are conversant of this. So all these things are AI-powered mannequins. We have some mannequins where we are teaching labor. It will just take you through the first stage, the second stage of labor, and so on. Those are AI-powered mannequins. All this makes our work to be easier. You know, when the clinical instructor will be asked to sit around in the lab, and they teach us, this is first stage. We teach us from Margaret Miles, the first stage of labor, second stage of labor. They just teach us the various, they say, but now, we can see if you have high-power mannequins, it will just take you through all the restitution, external rotation of the head, internal rotation of the shoulders. Those are high-powered mannequins. So, and we nurses must move with this trend. Also, teachers can also use AI in assessment and feedback. You can the automated grading system, where the students will go to there to write assignments, quizzes, and within a twinkling of an eye, the result has come. So all these things are what we should embrace in nursing. Let's also see in nursing education skill development. We have the SIMTs. These are also the companies that are responsible for this production. We have these SIMTs analyzes the CPR skills. So when you are doing CPR, there was a time I went for the training. When you have a CPR, when you are doing the CPR, you have the mannequin on ground. There's a where you press. At times you may feel that we are performing a CPR, and it's wrong. It just gives you a red light. When it gives you a red light, that shows you are not there. But when you push, there's a green light. Those are AI-powered mannequins. They will tell you this is that now you are there. Then that's when it is assumed that you are performing a CPR. So we also, I think I've talked about the intelligent tutoring system, and it's also help as a improved diagnostic reasoning and also clinical judgment. In research, we have the language processing as the one we use with ChatGPT. Also, we have these IBM Watson heads. Those are manufacturers. They have this predictive modeling. They can predict right from the data that they input in the machines, that if this also from these records that you have, there may be this outbreak of these diseases. There will be this so. Those are AI-powered machines that also help in predictive modeling. Also, we have, I think I've talked about this, accelerating the literature review. You have just throw it to AI and tell to it, what is, we go to the different sites and try as much as possible to gather together what is related to that field. And by the time it's bringing it, by the time you are reading it, it's superb. So all these also help us in AI research, and it's also help in accelerating recovery. Also, it also helps in drug recovery. Then in practice, AI in nursing practice, we have robotic assistants. We have robots like Spring and Mozzie. They are kind of types of robots. It can help in routine tasks, like giving serving of some serving of drug, some serving of food in the ward. Or there are times it will just alert the patient on this so. It will alert, this is the time to take drug. This is the time to do this. These are AI-powered, robotic assistant. It already knows. There are times when we are even on night duty. All of us are humans. There are times a patient is supposed to take drug by 12. You are even tired. Maybe that's the fourth or fifth night. You are tired. You may even sleep off. So this AI, it will alert. It will just know to go and do those routine procedures for the nurse. So all this makes practice to be easy. It also had the patient monitoring that the one I've explained earlier, that when you are in the ward, when you are having a machine that's AI-powered, it will just alert you about a patient's condition. So all this, and so that as nurses, you may take active or prompt action. Also, it also helps in workflow optimization. Maybe in a busy ward, you have a patient is coming to the hospital. You know, at times when we come, you will pay, you want to obtain card, you go and pay somewhere. Then you go to another place to go and queue for the card. You go to another place to go and take number for patients that will see, patient that will see the doctor, and so on and so forth. But when you have a workflow optimization, you can have it's power with AI. By the time a patient is coming, register, use the ATM card to pay, you know, by the time immediately it's giving the number that so this is so, and the time that you are to see the doctor. That makes the work, that makes it easy for the nurse and maybe also for the workflow in an organization. So also I want to tell that it is, as this benefits lies, it's also crucial that AI, it only complements human effort, and it's not that it's replacing the aspect of nursing or human aspect of nursing. Also, AI practice also helps the diagnosis, AI improve accuracy. We have this IDXDR screening. It screens diabetic retinopathy as early as possible in a patient. Also has this predictive analysis. I think I've spoken about it once. So also, the AI-powered diagnostics tools also help us early disease detection, continuous monitoring, and also in case studies. All these are the benefits of what we can derive from AI-powered tools or machines. So I think also the administrative tasks is all streamlined. We can streamline some of the administrative staff with AI. Staff optimization, AI is in most times, or the nursing, the schedules, AI can help arrange our schedules as nurses. Also, it also helps us in documentation. You know, before you used to write, by the time a night nurse is on night and is having about maybe 12, 15 patients in the ward, in fact, at times we'll be writing, even the morning nurses will come. I will say, please go and sit down. I'm still busy writing report. But now, I went to check one of our students in FMC, though, just last week, you know. As soon as I entered the ward nursing station, I said, please, I want to see this kind of patient. Just press on the system. And just took me to the say, he's in so. It's good. I said, what about the diagnosis? Within a tinkle of an eye, just check the system, click a particular number, and get all the biodata of the patient, and some of the patient, and the condition, and the next thing to do for the patient. These are things that makes our work documentation to be easy. Not writing report. And I say, you know, by this time we are doing this is reduce our time and reduce the workload. And it also save our time. So it also improves communication and patient engagement. AI chatbots answer questions 24/7. Ask something from ChatGPT 24/7. Just click. We give you answers. Yes. Then personalized education and virtual assistant. At the same time, as good as AI is, we should be able to strike the balance when we use AI. There are times that by the time some of our students, they are bringing their research work, chapter 1, if I see they are still even covered, you may not even be able to dictate when they are writing chapter 1. By the time you get to chapter 2, which is literature review, you will know that this student indeed, use AI, and it makes people to be lazy. And there are times that if you are not, even when AI is trying to, at least ChatGPT for instance, is trying to give us a direction, we should see it and try as much as possible and verify whatever information is giving us. So that at the end of the day, you won't want to do, what is it called, similarity index. And your similarity index of your this paper is going to 53%. Because some may not even bother to turn it in or paraphrase. All these, those are the things we must have checks and balance. As good as it is, we must be able to put it on a scale and be able to minimize the way we use it. Then, the future of nursing with AI, I know when we collaborate with people, it will also ask an assistance. In fact, I have a student, a PhD, I said, there's a topic that we devised, AI-driven, we were thinking that you'll be able to dictate, you can use AI to dictate how we can easily identify early signs of postpartum hemorrhage in a patient. We can do a research and collaborate with our computer science department, not nurses alone. Let's move with other departments, other faculties. They come together and do something about AI. So topics, things that you feel AI could do, let's begin to think about it and research into this. Then we have training through continuous education. This is essential for the effective AI use. You will see people from computer science that major in AI. Let's invite them. Let them take us through some things. And by that training, we'll be able to equip ourselves the more. And let's invest in AI research. And infrastructure is also critical, especially the one that tends to do with healthcare. And also conclusively, I want to say AI is a catalyst. And it has come to stay. It's transformed nursing better. And also have a better patient result and satisfaction from AI. And so that's why I'm calling us to action, to encourage collaboration, innovation, and ethical adoption of AI. And my vision is that a future where AI empowers the nurse, seeing a future where AI empowers nurses and also improve care. Thank you for listening.
Thank you. Another round of applause, please. Thank you very much. Embracing AI in nursing. So we have looked at the areas we have: nursing education, nursing practice, nursing research, and nursing administration. So, questions from the audience, please. Any questions?